It's a call that's telling me I'm here to serve. It's a need to make a difference in the world. 24 hours, day or night, these healing hands will make it right. Looking in their eyes, I know that I'm changing lives, changing lives, changing lives for the better, changing lives.
Hello everyone, I'm Grace Sells, and welcome back for another edition of Best Docs Network, the show that's featuring some of the best doctors in the Houston area that are really changing people's lives. Let's kick off today's show with plastic surgeon Dr. David Altamira, who helped one woman achieve the look she had always wanted.
You know, I just always felt like my body was out of proportion. When I would try on clothes, it was never when I looked into the mirror what I envisioned in my own mind. So I guess that's what prompted me to start researching and looking online. I never felt like my full potential.
Karen came in just wanting to have bigger breasts because she'd always felt that her breast size was out of proportion to her hips. She'd always wanted to be a little bigger. She just felt she needed it to kind of balance out her shape. So she was, after discussing it with her, a really good candidate for that.
As soon as I met his staff and him, I know he had that attention to detail. Just speaking to him, something about him set him apart from the others. He just made me feel safe. I knew I could trust him and his work.
So there's a lot of factors that go into it. By taking the measurements and using them carefully to that particular patient and matching it to the size of the implant, we can give them a good aesthetically pleasing size and shape that looks good and matches their body.
It was an outpatient procedure, so I came in that morning. The same day I was out and back at home. It was a really good experience. It
really made a huge difference in her confidence and self-esteem. It may seem like a small thing to just someone who didn't know her or just a casual observer, but in her mind it made a world of difference. It just really changed her personality. She kind of brought her out of her shell. She just felt better in a bathing suit, in photographs, just being out socially. So it was really a real blessing for her overall.
Before my breast augmentation, I was wearing a size A. And after the augmentation, I was a C. I had already decided I wanted a very natural look, and that's something that's very important to me. That is what Dr. Altamira gave me, a very natural look, and I'm very happy with the results.
A tomato is a superstar in the fruit and veggie categories. Tomatoes contain lycopene, a powerful cancer fighter, and they're rich in vitamin C. The good news is that cooked tomatoes are also nutritious, so use them in pasta, soups, casseroles, and salads.
My legs were very, very tired. I couldn't sleep, toss and turn, couldn't get comfortable. They would just hurt. And all night for years.
Restless legs is best described as a very strong sensation or urge to move your legs. It becomes disabling because it creates an anxious sensation. It's hard to explain. You're not sure what's causing it. You just have this overwhelming urge to move your legs. It almost always occurs at night, and because of that, it creates severe insomnia and severe anxiety.
I had varicose veins. I knew I could see them on the outside. I didn't know about the veins on the inside that were not allowing the blood flow to go past my knees. That would just go up so far and then just go back down to my feet.
We mapped her veins very carefully using ultrasound. We again isolated all the bad veins, the ones that were too large and the blood was running backwards because the valves had failed. and then we selectively ablated those using radio frequency under ultrasound guidance.
No pain, just a little stinging when they first go in with it, but really not much, even though they say, well, it's not going to hurt, it's not going to hurt, but it really didn't. The last treatment I had, I didn't feel a thing.
And we do that without any incisions or anesthesia. The patients can walk in, sit down, have the procedures done, stand up, walk out, get in their car, and drive themselves home.
I would say don't worry about it, just do it. Just get it done because you need to have it taken care of. Sleeping now, I rest comfortably, and it turned out good.
In the past, we used surgical procedures. Problems with that: one, it required general anesthetic. Two, it required big cuts with potential side effects like infection, damage to nerves, arteries, muscle, and they weren't selective. We were almost randomly choosing veins to treat, and they weren't always the only or maybe even the correct veins to treat. Now we selectively treat only the veins that are running backwards, so it works much better.
BestDocsNetwork.com helps you find the right doctor for your medical needs. Watch videos on each doctor and decide for yourself who fits you best. On the Best Docs Network homepage, you can see the latest videos, search for a doctor, find educational content, and watch the latest TV episodes from each BDN market.
Having a deviated septum is one of the most common reasons that people experience breathing difficulties. Let's hear from head and neck surgeon Dr. C.T. Nguyen and see how he was able to treat Irma, who was suffering from chronic sinus problems.
My biggest problem was that I got several allergies. I couldn't breathe. I was snoring at night. I was sneezing a lot during the mornings when I woke up. And I was always having nose discharge.
Irma is a young professional who came to see me because she can't breathe through her nose. She has this chronic problem that never went away. She consulted many doctors, and all she got was a prescription of antibiotics, and that's it.
Since I was a child, I had that problem. I've been treated for allergies. I get better for specific periods of time, but I travel a lot. I travel internationally, so it's different pollens and different trees, or the landscape is totally different, so I couldn't find a solution.
Doctors has treated Irma's problem with multiple course of antibiotics. I see this condition all the time. Patient has been treated with antibiotics, antibiotics, antibiotics. The problem is that antibiotics may improve your symptoms, but it will mask the cause of the problem.
He explains you everything. He shows you, like with endoscopy, I could see my nose inside. I saw where parts were infected, and he was telling me what he can do for me and what would be the results.
Decide upon a plan of treatment consisting of endoscopic sinus surgery assisted with GPS-like technology to target her diseased sinus.
He really accommodated the surgery to my lifestyle. He already told me, you are going to follow your allergy treatments with me, and now everything is working perfectly for me.
We are at the forefront of medical technology to improve our patient outcome. We want our patient to recuperate faster and feel better.
I'm breathing, I feel healthier, I feel younger. I highly recommend the sinus surgery for everybody that has chronic cold infections.
In today's Ask the Doctor, Mark from the Woodlands has a question for Dr. Annie. Why do I need to take so many medicines for high blood pressure?
Blood pressure is regulated by multiple receptors on a cell. So if you can visualize a cell having 20 different receptors, you can realize why one medication may affect one receptor but not the others. Therefore, it's better to have multiple medications affecting many of the receptors rather than going high dose on any one medication, because high dose usually can cause side effects. So therefore, the answer to your question is multiple medications are necessary to affect multiple receptors on cardiac cells as well as vascular cells to help regulate blood pressure. Very important to take care of that blood pressure. Keep it low. Protect your heart, protect your vessels, protect your life.
To find a doctor on bestdocsnetwork.com, you can search by your location and the doctor's specialty. From there, you can search through the doctors listed. You can even search by your current location to find the doctor closest to you.
You hear a lot about MRSA, MRSA. That's methicillin-resistant Staphylococcus aureus. Staphylococcus aureus is the staph germ, and if it's resistant to methicillin, that means it's a really powerful bacteria that over the years has developed resistance to many of the antibiotics that we used to use. Now you hear a lot of danger things about MRSA and MRSA. Most of that is not too bad in that MRSA is a very easily treated disease with certain antibiotics. However, if it gets away with you, it can be troublesome. Now, it is very common, and it can be more common in people who've been recently hospitalized or people who are exposed to people with MRSA, so you need to be careful about those kinds of things in your life. Now, MRSA generally results in abscesses, boils. It's not just red, tender skin. It's more where there's pus, you know, pockets of pus that may need to be drained. Now, when you go to your doctor, there are basically 3 antibiotics that we use for this, and oftentimes you'll need that area drained and lanced and packed. But get to it early and it won't spread. And don't worry about dying from this disease. It's very, very treatable.
For additional medical minutes from Dr. Honaker, log on to bestdocsnetwork.com and click on the Medical Minute tab on the home page.
I was pretty healthy up until I hit my 30s, and when I hit my 30s is whenever I was diagnosed with diabetes, and then from that point on, they start treating you right then for cholesterol. They start treating you for high blood pressure. I had started taking tests, and they changed my blood pressure medicines up. I woke up one morning and my heart was just out of control.
He presented initially with palpitations. Palpitations because of medication that he was taking for high blood pressure. He was not tolerating a medicine. And this medicine is a great medicine for blood pressure, but for him, it caused palpitations. So here's a classic example of how medications are studied, tried and true, used for years, but each patient is their own entity. Each patient processes medications in a different way. And for him, this medication was stimulating his heart, not quieting it down.
I would feel pretty confident that if it kept going the way it was going, I would end up having a heart attack. A lot of blood work was done, and once we pinpointed the problem, we put me on the right medication. I've been fine ever since.
And I had to, of course, immediately take that away, give him other medications that proved to be beneficial for his heart rate and his blood pressure. And he has done very well over several years, been very faithful to our practice, and brought many of his family members because of what we were able to do for him.
As far as how I feel now versus how I felt from the beginning, I feel 100% better, and not having to worry about waking up in the morning and your heart just be racing out of control. It's a good feeling not to have to worry about that taking place again.
Bill is doing fabulous. He is able to run his business. He brings his family members to be checked because he knows that there are rules and you follow the rules. And when you follow the rules, you do well.
The outcome of it is pretty good. I mean, like I said, if you control it, and I stay on, and I take the magnesium pills, and it keeps everything under control. I haven't had any issues since. I expect to live for a long time, I hope.
For more information and to check out additional videos on all the amazing doctors you've seen on our show today, head to our website. It's bestdocsnetwork.com. Now we move on to our next story. We're going to hear oral surgeon Dr. Paul Metz and how he was able to help one man boost his confidence with a complete smile makeover.
My teeth needed to all be extracted. They were crumbling, they were breaking, I couldn't chew my food.
He's a professional, an accountant, and he's certainly concerned about finances and how to structure his budget. And he was a guy that his lower teeth were worse off than the uppers. And so that was an area that he decided to focus on.
I guess this started in 2009, and this really happened in two settings. So that in 2009, we did the lower, and in 2011, we did the upper. The bottom is all done, and I'm in the midst of having the prosthesis on the top done.
And also with David, his concern regarding his budget, we were able to do this without grafting. Previously, in the upper jaw, because of the maxillary sinuses, we would have to graft those areas in majority of cases that we were placing a full jaw worth of implants. But with the advent of cone beam CT, we're able to look at individuals from a three-dimensional standpoint radiographically ahead of time so as to know where the bone is so that we can position implants within that bone and avoid the need for sinus grafting and then subsequently lower his overall cost significantly as well as increase the predictability.
No longer do I have to make sure that everything is in place where it's supposed to be in place. I have a new chance at a brand new set of teeth, and they don't hurt.
It's satisfying to see him come back smiling, see him walking down the hallway, standing upright with their chin up, smiling and being much more confident. So from a psychological standpoint, outside of the health benefits that you see, the mental health benefits are significant.
I'm a CPA. I meet with clients and high net worth clients. Appearance is important to me. It's certainly not of the utmost importance, but it's important to me. And I don't want to be embarrassed by a crumbling smile line. It's a wonderful, wonderful solution.
Carla has a question for Dr. Peter Morgan. What are the causes of venous insufficiency?
The risk factors or causes of venous insufficiency are, first of all, genetic or hereditary. Patients that have parents or grandparents or aunts or uncles that have large varicose veins are more likely to have disease that is caused by a genetic predisposition for the veins to get larger. The second risk factor is lifestyle issues, including jobs, occupations, or hobbies that result in standing or sitting for long periods of time.
Switching out that bag of chips with your sandwich to 3 ounces of unsalted pistachios will help raise your HDL cholesterol, which is the good kind.
I've always been slim or on the slim side. Always had a little pooch for a tummy, but it wasn't anything that I couldn't, cover up in clothing or suck it in. And then I wake up one morning and just went, what's this? And it didn't matter how much I exercised, I've always ate well. I could not get that stomach to go down, and it happened in the upper section also.
Our patient for CoolSculpting came in for abdomen treatment, very concerned about her stomach. She had areas that she couldn't get off despite diet and exercise.
So I just went, clothes aren't fitting, I can't go on like this. And so I started researching, and I decided on the CoolSculpting simply because it's non-invasive. I didn't want to go under the knife.
So the CoolSculpting procedure will take about an hour. It is non-invasive. When the procedure is done, you can go about your daily activities. You'll see the most results at about 2 months. So the whole concept is you can take the skin and the soft tissues to a lower temperature, freeze the fat, which actually kills the fat, but it leaves the surrounding tissues intact.
Of course, you get the list of what could happen, and I didn't have any cramping. I did have just ever so slight bruising, not purples and blues, just a little red and a little tender, and that was it.
It is permanent. The affected area will kill about 25% of the fat cells.
The recommendation these days is to do 2 treatments within a month so that we can get about 50% reduction of the area. Some patients just need 1 and they're happy with it, but a lot of patients can get 2 and get better results.
I had it a year ago last January, yes. And I'm just really thrilled that I had it done. My clothes fit again. I could not wear this skirt a year ago. And it was cheaper to have it done than going out and buying a new wardrobe. Simple as that. I would say I'm a victim of fashion, and I like feeling good in my clothes. I like to look good. And so yeah, there's a little vanity in there. And the hubby kind of likes it too.
Each doctor on the Best Docs Network website has their own profile page where you can watch videos on the doctor, read info on their background and training, find their office locations and directions, as well as ask the doctor a question and request an appointment. University General Hospital is a hospital like no other, with state-of-the-art medical treatments in an inviting environment that pampers patients and families and encourages relaxation and healing.
I decided to come see Dr. Marvin because I struggled with weight my entire life.
Well, Amanda's a fairly young patient. She's in her mid-20s when she had the surgery. She did meet the National Institute of Health criteria for weight loss, which means that her body mass index was 41. She was morbidly obese. She wasn't manifesting too many other medical problems related to her weight yet, but again, she's on the young side, so she had some lower extremity swelling and those kind of things. There's tip-offs that things aren't quite right.
I was very uncomfortable. I was like one of the only heavy people in my group of friends. My husband is very lean and active, so it had a lot to do with our lifestyle, and I wasn't able to go to the pool, and I didn't want to wear sleeveless shirts, or when my friends went out to the club, I didn't want to go to the club, and so it had a lot to do with my age, and I wasn't able to live life.
Amanda's lost from 240 pounds down to 128.5 pounds, and that's a very significant weight loss. That's great. That's a very good outcome for a gastric sleeve.
The recovery for me was pretty simple. I took 2 weeks off of work. I could have gone back within 5 to 7 days. I get emotional when it changed my life. Just wearing sleeveless shirts, being able to dress like everybody else, being able to spend time with my husband and go to the pool and just be active. A lot of people started to talk to me again because I wasn't friendly whenever I was heavier. I was angry, I didn't want to do anything, I was like a hermit. So my responses, they want to know how I did it, and I'm very open about how I did it. I was like, I had the surgery. I couldn't do it myself. I could not do it without the surgery. Could not have done it.
My patients, since obesity is a systemic disease, when we cure it for them, they get better on so many fronts. It's nice to see how they're doing afterwards. They really are changed people.
75% of Americans experience foot pain at one point in their lives. Bernard was experiencing foot pain and toe numbness, which was keeping him off the golf course. Let's see how podiatrist Dr. Gabriel Maislos was able to correctly diagnose his foot problems and get him back to playing golf.
First started having some pain in my right foot after an incident stepping out of a pool. And I thought it was just a simple bone bruise, but then I had some numbness. And so I went to see some podiatrists, and initially they felt it was related to my diabetes.
When he came into my office, he complained of shooting pain in his toes. So after doing an examination, an ultrasound exam, and then he exhibited signs of a neuroma. A neuroma is essentially a nerve that is compressed by the sides of the metatarsal. So the nerve courses in between, and with a neuroma, it becomes inflamed. And after a while, it develops like a fibrous sheath, and it's no longer just inflamed, it's enlarged.
In terms of quality of life, I'm a big golfer, and it was really made every day, and certainly the enjoyment of playing golf a lot less enjoyable because because of the problem.
So Mr. Weber came in with the symptoms of a neuroma, and I believe I treated him a couple times with sclerosing injections. Orthotics were given to him, and as well as instructions on stretching and taking an anti-inflammatory. And he just didn't get better. So at that point, he elected to have surgery.
Well, I think certainly in my case as a diabetic, and given that the symptoms are so similar, that this could happen to other people. I wasn't even aware of what a neuroma was, and being a diabetic, so I think just awareness is a key to understanding that numbness doesn't always mean diabetic neuropathy, and it could be an actual injury to your foot, and you should see a podiatrist.
The procedure, it's very rewarding because patients like it, and there's minimal pain postoperatively. If anything, there's some temporary numbness, and then after a while, patients regain sensation.
My experience with Dr. Maislos, what I like about him is he is very circumspect. So he doesn't assume anything. Let's go through all the steps. He's really interested in finding a solution. Very pleased with the care that the doctor has given me.
BestDocsNetwork.com also has a video library of all the doctor's videos that you can break down by doctor, topic, and specialty. This is a great way to find videos quickly and watch all the videos associated with your needs.
I came to Dr. Lewis because I always wanted to have really white teeth, and my teeth were straight. I never had to wear braces, didn't have any of those issues, but I had extreme sensitivity. So I could not use any of the whitening strips or just the gels that anyone could. My gums were receding probably because I am one of those brushers that brush the wrong way. Didn't do the circular motion.
She really wanted veneers. She had just gone through a lot of personal stuff, and she wanted to make a change in her life, but she really did not want her teeth touched. She did not want anything reduced on her teeth or anything prepared.
So he sort of walked me through the process, and I found out that what he could do was I didn't have to have any, didn't have to have my teeth all filed down. They just sort of buffed them, and he just recreated sort of my smile. It's really strange because it didn't change a whole lot, but it did change a whole lot.
So we did the set on her, and they turned out beautiful. I've done thousands of them, and people are very happy with them. And what we found out is, in most cases, they're stronger, even though they're very thin, they're stronger than regular veneers because the strength isn't derived totally from the thickness of porcelain. I mean, you have to have a certain thickness, but it's derived from the bond to the tooth. And we found that when we bond to the enamel, which is the natural outer layer of the tooth, that we get a much stronger, much harder veneer.
Just the craftsmanship was amazing. I mean, it was like going to a Da Vinci or somebody, because it was such tiny details, but it really changed my smile.
So in actuality, not only are they, less destructive to the tooth, or you don't have to take anything off the tooth, but they're also stronger, and so they look great.
It was painless. Came back, put them on, was getting my hands massaged during the whole process, and I walked out and I had a perfect smile that looked natural. I enjoy smiling, and I love having people say, "Oh, you have the prettiest smile."
Those were some amazing doctors that we had on the show today. And that's going to wrap up this edition of Best Docs Network, the show that's featuring some of the best doctors in the Houston area that are making a difference in people's lives. If you have questions or comments or a life-changing story, we would love to hear from you. Send us an email at info@bestdocsnetwork.com. Thanks again for tuning in, and I'll see you next week.